International. We've got about 10 countries around the world that we do our work in to distribute eyeglasses to people in need. And our project is based in Liberia. When I say our project, I mean the project that we at Good Vision USA run. So Liberia is a country that's located in the West African coast, as you can see in the map there. As you guys may know, I lived in the Congo, which is right here, in the 80s as a Peace Corps volunteer for 2+ years. But Liberia is over on the West Coast. Basic facts about Liberia. It's a very small country. It's actually sort of, I think, the size of New Jersey, slightly larger than Virginia, and has a population of about 5 million people. And they do speak English. And the capital city is Monrovia, which is where we spent most of our time. It was settled in the early 1800s by former US slaves who were sort of sent over by the American Colonization Society in a sort of a patronizing way. They sort of felt that these freed slaves would be better off in a country that they had, more association with than anybody else. And this, sort of caused a lot of problems, as you can imagine. They became sort of the ruling class, and that led to coups and civil wars in 1980 and 2003 that were really, really brutal and led to a lot of mass displacement and refugee movements and casualty and trauma. In fact, a lot of the people that we work with as colleagues that are sort of my age have in fact lost a lot of family members. And, this, I would say this society is still very traumatized by their brutal past. Additionally, the Ebola epidemic happened in 2014 to 16, and this really strained the health system and the economy and did weird things to the economy because it sent a lot of money and a lot of NGOs into the country and sort of boosted prices in a place where people could barely afford it. But things have stabilized there now, which allows us to kind of do our work. However, there are a lot of challenges in there, and this is incredible. This slide right here shows the condition of the road to the clinic that we were working in, which is actually based in Monrovia. So this is in the capital city. This is the condition of the road going to the clinic. And you can imagine what kind of problems this causes if you're driving on a road like this every day, trying to get anywhere. Liberia is one of the poorest countries in the world. And just to give you an example, the GDP per capita is $600. And just for comparison's sake, it's about 60,000 in the US. It's considered one of the poorest countries in the world. People sort of survive on the average of about $2 a day. Most people, only 12% of the population has access to electricity. And, which means, that they're lighting, for instance, and from the point of view of vision, lighting in houses, you'll drive around Monrovia, the capital city, at night, and most houses don't have light at all. So, this obviously impairs your ability to read, to see well. Additionally, 48% of the population is literate. And there's a huge lack of physicians. There's only about 0.04 physicians per 1,000 residents and 65 ophthalmologists serving the entire country. I actually think this number is higher than the real number. So this is one of the things that we're trying to address in our work there. The purpose of our visit was just to check on the progress of our project there. After 2 years, we've worked with our colleagues there for 2 years and never met them in person. And then to strengthen connections with our partner organization, which I'll tell you about in a minute, and other governmental entities. And then to look for ways to expand our project and also to celebrate this group of what we call GVT's, Good Vision Technicians, who graduated from our training program after a year of hard work. So we partnered with this wonderful organization called Refuge Place International, which is a medical clinic based on the outskirts of Monrovia. Refuge Place indeed already had a small eye clinic. And now, so this health clinic outside of Monrovia actually serves as our headquarters for the Good Vision Liberia project. And one of the things that we're able to do is we capture all the patients who are coming into the clinic for anything, headache, a stomach ache, and they're diverted first to do a screening at the eye clinic, because not people oftentimes in developing countries don't really sort of even understand that their vision is impaired. If you've just been seeing in a blurry way your entire life, you might really not really understand that the world is clear, which is really just unfathomable to us in this country. But it's true. And so, this is sort of the purpose of the work that we do. And why Liberia? Because I worked at the Harvard School of Public Health here many years ago, and was I luckily got to meet Dr. Masoka Fala, who's an epidemiologist and who was studying there for his PhD. And funnily enough, we stayed in touch. And then he saw on Facebook that I was posting about my work with Good Vision, and he said, "Jen, you've got to bring Good Vision to Liberia. When I was a kid, I had to travel to the Cote d'Ivoire, to Ivory Coast, 2 countries over, on a bus for 3 days to get glasses for myself because they're so unaffordable in Liberia." And that still is the case. So one thing led to another, and we established the connection with Dr. Fala and with the Refuge Place International Clinic, which has just worked so well. So here's a picture of the clinic. As you can see, it's very simple, but it works well. We were there for 12 days and working out of the eye clinic, and it was just a constant stream of activities, people coming into the clinic for services. It started off as a maternal and child health clinic, because the rate of maternal and child mortality was extremely high, and they've actually managed to really improve those health metrics, and there have been no deaths at all of either mothers or babies in the period that this clinic has been around. So they've done really well. And now they're starting to open new clinics, 2 more that we were able to visit, and they're planning for 3 more beyond that. So, so you can see here how that the facility is really simple, but it's very clean and everything works beautifully. The different departments in the clinic are emergency care and triage, maternal and obstetric clinic. There's an eye clinic. There's a lab where they do basic testing for malaria and I think TB and even HIV and other more sort of simple things. There's a pharmacy, and there's a pump with well water for the entire community. It was very sweet at the end of the school day. You see lots of kids coming in and bringing their buckets and containers to fill up and bring home, because people do not have running water in their homes. And the facility also operates on very intermittent electricity, which is, as you can imagine, a challenge. As you can see here, this young fella is keeping records for every single patient that comes in this very sort of old-fashioned looking ledger, but it works. And you can see up on the wall behind him are binders. So every time you need to look up a person's health record, you have to go find it in some of these binders. You can imagine how sort of cumbersome this is. There are a total of 95 employees in 3 clinics, including nurses, nurses' aides, midwives, traditional midwives, pharmacists, lab technicians, and then administrative staff. And then let's move along to the Vision Project. So here's one of our Good Vision technicians. And we now have a team of 11 Good Vision technicians who passed the training and have been promoted to be full Good Vision technicians. They've gone through a year of training, and they perform eye screenings both at the central clinic and school and community outreaches, which is really a big part of the work that we do, because we've come to understand the public health field in general has come to understand that, you know, when healthcare, eye care is hard to access, people really don't have the means and the resources to access it. So for instance, if you live in a small village and you need to take a bus or that costs money, or other mode of transportation to get to a clinic that's far away, you're likely not going to do it. So instead we bring our eye services to the community. And I just want to tell you a little bit about Good Vision's model, because we do have a really interesting model that's different from a lot of other organizations that are in the healthcare, that are in the vision care sector. And that is that we create these simple eyeglass frames that you can see here at the bottom of your screen. We create them locally with this vending machine here that doesn't require any electricity at all. And a Good Vision fabricator, frame fabricator, can actually create these simple frames in about a half an hour. And then the Good Vision technician will take a collection of frames and a collection of lenses right here in different powers, ranging from -8 to +8 in half diopter steps for any opticians that are in this audience here, and take them out to the villages or to different locations within Monrovia, and create glasses right there on the spot. They do the vision screening, do a simple refraction, get a simple prescription, and create glasses and dispense them right there on the spot. And this, avoids the need for those that are looking for glasses to take a big trip and to spend a lot of money. We do charge for our glasses, because we have learned that if people pay a modest sum for glasses, then they will be more invested in them. And Good Vision as an organization has done a lot of research into sort of affordability, and sort of determined that 3 to 4 times daily wages are sort of right in the ballpark of what people will be willing to or are able to spend comfortably. So we do charge $5 for our glasses in Liberia, although when we do outreaches in schools, of course, we don't charge school children. And, there is sort of a sliding scale of people really can't afford it. We find a way to make sure they get glasses. And by the way, if anything happens to your glasses, you can get the lenses replaced for free. They pop in and out of these frames very easily. And by the way, while these frames may look very simple and look maybe even not so robust, they are incredibly robust. German engineering has been applied to this, and you can even see on our website videos of eyeglasses that have been, you drive over them in a car and the frame just needs a little bit of adjustment. Probably you need new lenses in there, you pop them in and they're good to go. Okay, next screen.
Jen, one question. There's a question that Mario said it's a wonderful service. How much does it approximately cost a person to become a Good Vision technician?
Oh, hi, Mario. Thank you. What a great question. We do not charge, we actually pay salaries. And this is a really big and important part of the work that we do, a benefit of the work. And you'll see it in a minute when I'm talking about impact. But we actually pay, after the Good Vision technicians have been hired, we actually pay them. So the Good Vision technicians that we have been paid a salary throughout this entire year. And this is in a country where jobs are really, really hard to come by. And we're creating meaningful employment. So we feel really proud of this as sort of an impact of the work we've done beyond, improving vision of people and, opening up opportunities to them for just, quality of life improvements, but also academic opportunities are opened up to them. And then from there, professional opportunities are open. Poor vision is really a pathway into poverty. Oftentimes, if there's someone who's so visually impaired they can't see, in countries where there are no services available to them, a child will have to stay home from school with like an elderly grandparent, for instance, who's so visually impaired through cataracts, let's say, that the child will have to stay home from school and not be able to attend school. So good vision, as you can imagine, most of us, have some kind of visual impairment, or at least will after we get to age 40, need reading glasses. And we don't think about it much because we just pop over to the drugstore and buy a pair of reading glasses. But in countries that those aren't even easily accessible or affordable, I mean, imagine if you were an elderly person and you can't, your ability to sort of get around is minimized. And one of the things you enjoy doing is reading, and you can't do it because you don't have a simple pair of reading glasses. Imagine how your quality of life is diminished. So even simple reading glasses are huge importance to the quality of life of people. So anyway, up on the screen here is an outreach campaign. And this is where we go to schools, or we'll go to community centers that you can see. And we perform eye screenings, we dispense eyeglasses to those who need them, and we do medical referrals for those who, so Mati, our ophthalmic nurse, who is the leader of the Good Vision Technicians, she does simple eye exams and identifies people who need further referral. So we do refer people to clinics where there are eye doctors. And so again, we observed while we were there, we were there for the graduation, which was really, really an exciting event. I couldn't actually pull up couldn't find quickly a picture of the actual graduation, but this is a picture of some of the male GVTs at one of the certification ceremonies, just so you get a sense. And this is a picture of Mati right here, our wonderful ophthalmic nurse. And here's a very top of the Good Vision Technicians studying for some aspect of the exam. And this is Samuel in the right-hand corner, actually works in a project in Malawi, and he got on a plane for the very, very first time in January 2021 and went to Liberia and did the theoretical training for the Good Vision Technicians. So it lasted a year. And it was conducted by Samuel and Mati, and we attended the joyful celebration. Okay, so the impact of our work is that, in this first real year of our project, while the Good Vision Technicians were in their training, the impact was limited because they were focusing on the training and couldn't get out to do the outreaches and needed supervision by Mati. So the number of individuals that we screened and glasses that we dispensed and number of referrals was limited, but it's really going to grow in the year ahead as we've got, trained Good Vision Technicians who can work on their own. And despite that, we were still managed to create 22 jobs. We screened over 10,000 individuals to ensure that they don't have some ocular disease or need glasses. And those that did, we dispensed over 1,200 glasses, and we referred 300 for referrals. And there's lots of challenges. I won't pretend that there's not, but I think it makes our work that much more meaningful and impactful. Resources are a challenge, of course. The infrastructure, as you saw, is a huge impediment to getting our work done. The lack of local knowledge about the benefits of eyeglasses is another challenge. So we do have to do a lot of awareness work, which involves going into communities, talking to people, passing out flyers. Prior to every outreach, there's a lot of pre-work that needs to be done to kind of get people to understand what the benefits of these glasses are. And so, a lot of our time is spent doing that kind of thing. And then poverty itself, of course, excuse me, is a huge challenge to kind of, dispensing as many glasses as we want. All right, let's see.
Jennifer, how is outreach actually done? Is it through schools? Is it through flyers, convenience stores, grocery stores? How is that done?
in all of those ways.
Okay.
We do a lot of actually going out to the community, believe it or not, with bullhorns, just like old-fashioned bullhorns, and making announcement that there will be outreaches on certain days. We go to communities and we pass out flyers. There's education of individuals when they come into the clinic. We do a lot of press. So when we were there, the first morning that we were there, we did a radio show actually, and gave out the cell phone number of Jim. I don't know if Jim's on the call right now, but Jim is our project manager. You see him in this slide right here he's this guy right here. Wonderful Jim. And Jim gave out his private cell phone, and his phone started lighting up immediately.
That's awesome.
It was so cool. And so we had people come to the clinic while we were there. One guy came and he traveled for hours for a pair of glasses, and he brought his friend, a rice farmer from even farther away, to come for a pair of glasses. So these are the kind of ways that we do work to, sort of educate the community about glasses. And, as time goes on, we're going to be doing more collaboration with other NGOs to perhaps, make our glasses available. There are a few eye clinics around. So these are the kinds of things we're working on. All right. Feel free to ask questions, guys. Why this cursor keeps getting stuck here.
Jen, there's another question.
Yeah.
From Calvin. What do you do in case someone discovers a potentially serious eye condition?
Yeah, this is a great question. So right now, our referral system is that we give them information about their condition. We give them specific information about the clinics that they need to go to, and we tell them to follow up with Mati, our ophthalmic nurse at the clinic, who has diagnostic equipment to help identify problems, and she can actually do some treatment of some very, very basic eye ocular problems. While I was there, we discovered 2 patients, for instance, and I actually accompanied them down to the eye hospital. But one of the things that we really want to work on in the next phase of this work, and for which we're always looking for more resources for, is to do a supported referral system, so that we can ensure that all patients actually take that information about needing to go to a clinic, and we actually can ensure that they have the resources they need to get there. So be that vouchers for transportation, be that follow-up from Mati or other members of our Good Vision team, whose job it is to, check back with these patients and make sure that they've actually, gone to the clinic. In some cases, we may need to accompany patients to the clinic and communicate. So this is, we do hope to, as we move on, move to a more complete sort of and supported referral system. Does that answer your question? Oh my gosh, there's lots of questions here. Any other questions, Sally? Or maybe I'll just look here. Let's see. Oh, great. So Laura, let's see.
Peter made some comments about that he willing to explore working with PCVs when they are back, and the Rotary too. Amy asked, what does the Good Vision training include?
Okay, so the Good Vision training is a year-long training. It includes lots of optics, lots of dispensing, understanding refraction, understanding very basics of eye diseases, even though that's not we are not treating eye diseases, and we were very careful to make sure that that's clear. But we do give the Good Vision technicians basic training in ocular diseases, so they can identify ocular diseases, and they are not allowed to do any diagnostics. They can't even say, looks like you've got a cataract developing, which is something we often see in countries that are close to the equator and where sun is really a problem. But they can't say that because we don't have the kind of qualifications to do that. But Mati can do that, and so these are some of the components of the training. Another thing that's interesting about the training is that we do actually do some work with sales techniques and, really learning how to talk to patients and customers about, what do glasses mean to you? Why are they important? Why is it worth your time to, acquire these glasses? What is it going to bring to you in your life? So these are all the components. And then there's lots of practical. So, months and months and months of practice to ensure, because we're not, as someone said, we're not selling bananas here. We're selling medical devices, and we have to be really, really careful to ensure that that they are very precisely fit to the patient's needs. And that's, to be honest, when we keep it's very important to us to keep our optical standards and the standards of the GBTs up really high. And that's another reason why we're in close touch with the Ministry of Health and ensuring that our qualifications, meet the country's standards also for opticians. All right, let's see. Other
Jen,
questions?
if I can
Yeah.
make a suggestion, why don't you finish the presentation? We've got a lot of questions and we'll just
Okay.
get questions at the end.
Okay, absolutely. Yep. Okay. Resources, talked about that. Okay, what's next? Building up the capacity of our team, expanding the project. I mean, that's obvious. That's our hope, is over the years to expand the project, hire more GBTs, dispense higher rates of eyeglasses. The need is absolutely huge in Liberia. We'll eventually move on to some other countries. I mean, as I said, Good Vision Internationals, we're already in 10 countries, but the need is absolutely enormous. So create a supported referral system, as I talked to, sending a team from Good Vision to Liberia every year so that we can share the knowledge that we've gained in the work in other countries. And then also align with other NGOs and see how we can cooperate with other nonprofits that are working in the vision sector. And here just quickly, you can see the Good Vision technicians doing some practice at the clinic. And then below is, we're meeting with the Dr. Kirkula in the bottom shot, who's the head of the eye department of the Ministry of Health. Okay. And just here's some general impressions of the country. And I just wanted to say that, Liberia has had a lot of challenges, and it still has a lot of challenges, but I cannot express my gratitude strongly enough, and the impressions that all of us had on the team of what warm and wonderful people they are. So if you ever get a chance to go to Liberia, if you ever get a chance to come with us on one of our trips to see our program, you also will just be kind of bathed in the humanity and generosity and kindness of the individual, and fun. I mean, we just had a lot of fun. So here's some pictures of just some of the the clinic, one of the clinics that we visited. This is an outreach. This is a young girl with albinism, and lots of people with albinism experience eye problems as well. So she got a pair of glasses. And here's a picture of, on the right, one of the many articles that was in the paper from our visit, which was very fun. And we over here are mostly volunteers, and we have a lot of fun working together, and we are always in need of new volunteers. So if you are interested in working with us, practically any skill you have, we could put to good use. Particularly, we are looking for people with financial management skills. We need to grow our board, advisors, marketing. We're only as strong here in the US as our marketing work is, to get the word out about what we do, and of course fundraising. And we do have a program of that we want to really roll out. We keep talking about it, but of course COVID slowed us down. But as we want to get into retailers, optical retailers around the country, and teach people a little bit about the lack of eyeglasses is available for people in developing countries, and pair up with these retailers and, get donations per pair of glasses sold. So we could definitely use some retailers that are interested in participating in this program, and also some support to grow this program on the sort of organizational end. And lastly, of course, we are always in need of more financial support. So any donations that you guys would like to make to our organization, they go really far, in Liberia, because, it is a poor country. I mean, the money can go very far. And so we're always looking for support for the work that we do, corporate support, individual support. So I think that that's it. And this is the way you contact us. Obviously, you can reach out to me directly, but let's go to questions now, and feel free to just ask away. Oh, do we do sunglasses too? Let me try and see if I can address some of these questions. We do sunglasses. Yep.
Yes, Jen, so one of the first questions, is there follow-up with people once they receive their glasses to ensure they're using them, any adjustments?
We honestly have not, we don't reach back out to them. That's just that would be a tough to reach out to everybody. But the eye clinic at Refuge Place International here in Monrovia that you're seeing a picture up here, individuals are told at the outreaches that they can come to the eye clinic, that any adjustments to their glasses is made for free, that if their lenses get scratched or broken, that all gets replaced for free.
What does the actual vision screening look like? Is there equipment that you use?
Oh, yeah, that would have been a good picture to show. Yes, interesting question. So there is, and maybe I can go back to one of the pictures. I can't remember if it was in there. Well, I'll just describe it now. So we use what we call a lens bar. And the lens bar is literally just a bar that has little lenses of different varying powers attached to it. And interestingly enough, this is sort of a very simple equivalent of the phoropter that you're used to seeing when you go to an eye doctor, that machinery where the doctor puts down and says, oh, is it better or worse? It drives everybody crazy. Is it better or worse? So this is kind of the same thing. You can move different lenses of varying strength just with this lens bar. And this is the way, we sort of triangulate. There's different ways to find out what a person's prescription needs are, but after you've done that, you have to just ensure that the glass strength that you have diagnosed for them is really the right one, and that's the way we do it.
Do the GVTs have set targets or goals for the number of people that they screen? Do they receive guidance and support to determine where they are providing the service, i.e. which schools, villages, etc.?
Oh, okay, great question. We definitely have targets. I will have to be honest that we were not able to, in COVID, meet all the targets that we set. You can understand why. And they do receive guidance and support, but we believe that, the good vision technicians and the people in the clinic themselves are much better at identifying where the needs are. So we really don't get involved in that sort of aspect of things ourselves. Are on the ground project directors, Jim Sua, who you saw, and Mati, along with the good vision technicians, make the determination as to where the needs are, where the schools are, where the villages are that need services.
And how can we donate right now?
Oh, isn't that nice? Thank you, Mario. Okay, so just go right onto the website, which I'm not going to try and pull up because my technical skills are lousy, but it's www.goodvision.org, and you will see a donate button on there, and you can absolutely donate right now, and we would be very grateful for any contributions. Any other questions, Sally?
No, just lots of very, very nice comments for you to read. But
Oh.
actually, if you don't mind, can I correct you? It's www.goodvisionusa.org.
Oh, sorry, yes. Exactly. Goodvision.org will bring you to the greater Good Vision International organization. Let's see, another question. Okay, well, I've come to the end of my formal presentation, but if anyone wants to ask any more questions, speaking up or in the chat, please feel free. Okay, well, I really, really appreciate your participation in today's call. And I'm sure that the Good Vision technicians and people of Liberia appreciate your interest in what's going on in the country too. So please be in touch if you have any other questions. Thank you so much for your participation today. And we will be in touch. Take care. Thank you so much. Bye.